So to show you the process from the beginning, I just wipe the data of our previously done analysis. So when you open the recording for the first time, you have it clear without any analysis, and here you can review the recording just by naked eye without having any additional information from the software. On this first analysis page or a record preview page, you can scroll through all the 24-hour recording in quite easy, quick way. And why it is important? Because you can assess the quality of the recording. So if you scroll down and see some maybe noises or parts where maybe electrode was taken off or some lead failure, you can prevent these parts from influencing the analysis. Just for example, we have here in the beginning some noisy part, and let me think that I don't want this part to be included in the further analysis to prevent some interference with the results or faulty data. So what should I do here? I want, for example, these parts to be excluded from the analysis. How can I do this? First, I need to select this part for some manipulation. So the selection process is the general procedure that you can use in different scenarios with our software. So to select something, you just need a couple of tricks to remember. But if I want to select some small part of the recording, like maybe some seconds or minutes, I'm using a simple way, pressing Shift button, left Shift button, and then left mouse button. I just go through the recording, and part of the recording is marked like bright green, and this part is now selected for further manipulation. So I can do something with this part of the recording. But this simple way of selection is not convenient when you want to select big chunks of data, again, for maybe noise reduction or for other purposes. And in this case, you should use another trick, and I will show you. So in this case, you again press Shift button and click left mouse once. Do you see this marking here appear on the screen? And then you can scroll all the way through the record, how long you want, but I don't want to be too long. But the main idea that this first marking may be far away on the other screen, and then you just press Shift button and left mouse again, and all the record between these 2 points is now selected. So it's quite easy. And as soon as I select it, I want to do something with this part of the recording. And here I wanted to exclude this part from the analysis. Here I can use right mouse click and select some options from the drop-down menu. So that's another instrument to do something with the recording, is to use this right mouse click and drop-down menu. And for example, here I want to delete selection from the analyzable record. Press this option. Now this part is out of the analysis. But you see that this part is not actually deleted or wiped in some way. You can see ECG here. You can see that the complete ECG is not disturbed. So if you change your mind, you can do the backwards operation and again include this record into the analysis. Just doing the reverse, just select part of the recording, press right mouse and delete, not delete, but add selection to the analyzable record. So that's quite a simple stuff that you can do right here in the preview window. Also, when you use this scrolling in a preview, you can understand which of the three channels are better for analysis and which channels better to include as basic for the analysis algorithm to search queries, complexes, and different events here. So as this preparation phase complete, so now I'm satisfied with the quality, I can now go to the next step and perform automatic analysis. I press this button. Actually, when you open the recording for the first time, and this recording has never been analyzed before, you have this window pop up automatically, but you can first close it and perform this quality check, and then call this window back with this automatic analysis button. What I can have here. So this point about artificial pacemaker is only interesting when you have a patient with artificial pacemaker implanted, and here I have a patient on a normal rhythm, so I do not select this. Automatic P-wave search, it means that just if the software will try to find and analyze P-wave on the recording. So if due to some reasons you are not interested in this part, you can skip this, and this will improve speed a little bit. So because the software will not spend time on searching P-waves. Then I mentioned before that I should select two channels that are better for analysis, and here I clearly see that the first and the third channels have high voltage, sorry, and the second channel is low voltage, so it's not best choice for analysis. In this case, I opt for first and third channels. Then sensitivity threshold. Basically, parameter 1 is by default, but if you complete the analysis and see that some curious complexes are missing, you have false pauses, that software says, okay, this pause, but you see that there are actual curious complexes, you can perform analysis again using different sensitivity threshold. So it depends on the quality of the record, of some specific features of this particular patient, but in most cases, number 1 works. So the process can take a couple of minutes because the software needs to process about 100 curious complexes here. Quite a big deal. And while it is analyzing, I will point your attention on this part of the screen, that on the bottom of the screen, this called the ribbon tool. Actually, it's a very useful feature because it is used during all the processing of the record. during all the analysis steps. And this tool includes the ECG representation, so 3-channel ECG. It's about 8 seconds length here. If you have 50 millimeters per second speed, but you can change to 25 or less. It depends on what you want to see. Just switch here. So you can see ECG here in full scale. If you want to see more details, you can switch to 100 millimeters per second, or vice versa. If you want to see some rhythm pattern more clearly, you can switch to 25 or 12.5 even millimeters per second, but usual speed is 50 millimeters. Also here you can apply drift filter or switch it off. Here, not a big deal, but actually you can hear that something changed now on this screen. You can also switch off some channels if you do not want to see it, or just to focus on another channel. And this function is more for 12-channel recorders, but now we supply only 3 channels now on the market. So that's not very important things. You can check it in the manual, or we can deal it later if we need. These settings window, you can use it sometimes because it sets some default parameters for the analysis. For example, how the software deals with the heart rate calculating for different tables and graphs by averaging or by using some median filtering. What is the criterion for pause? For example, here, due to some reasons, 6 seconds, but usually we have 1 8 seconds. Or why, for example, we can change the pause criterion. As a general, for general analysis, we have these 1.8 seconds or 1,800 milliseconds pause. But if you want to see longer pauses that like 3 seconds, 6 seconds, when you decide if the patient needs implantable device, so you can change this setting, and the software recalculates the results. Again, with extra systoles, we have some algorithms to detect ventricular, supraventricular extrasystoles, but you can change the sensitivity of this algorithm if you see, for example, errors in detection. The same applies for arrhythmia criteria, because we have some heart rate thresholds. And for example, normally that like a ventricular tachycardia is usually detected if you have heart rate above 110, or in some guidelines 120 beats per minute. So you can change these parameters here depending on your practice or your current guidelines. So we cannot change our software as fast as for sometimes new guidelines come out and change the recommended values, cutoff values for different analysis. Also, for example, for ST analysis, you can switch which episodes you want to exclude from the ST analysis, because by default we usually consider only normal sinus rhythm. So if we have some arrhythmia, so we want to exclude this arrhythmia from ST analysis. This is setting window. On the left panel, we have so-called filter panel. Using this panel, you can always see different events. So when we now we analyze the record, and our software detected different events, and the first event that can clearly be described, that's the QRS complex and P wave. So you can see here on the part of the record that we have on the screen that every QRS complex detected is marked with a bar here. The color of the bar is different for different types of QRS complexes. For example, for normal, that's green. And the size of this bar depicts the actual reference point of these QRS complex, the beginning of the QRS, the J point junction, and the end of the T wave. Actually, you can correct the position. For sure, nobody want to do this manually for 100,000 QRS complexes, but you can do if you want. Another marker is for P wave. Again, this P wave have this bar that shows the start, the end of the P wave, and also it has the color coding, and you see the text appear when I hover the mouse over the P marker that is effective. It means that this P wave has some QRS complex after this P, so I can understand that this P wave is actually more or less normal because it causes some QRS complex. When I hover mouse on the QRS complex bar marker, I can see that this is sinus and it's not an extrasystal, so that's quite normal. Another events appear on these so-called tracks, and we have something for basic rhythm, for alloarrhythmia, for supraventricular and ventricular tachycardia, conduction anomalies, and some additional data that may be imported in the software. And here, using this, for example, base rhythm line, I can show you the example how the filter function works. So you see, I select this base rhythm track, and here see the the same name here. That if I switch to QRS, I see different parameters that I can select. For example, for base rhythm, I want to see if there are which base rhythm our software has detected. So, for example, I want to see if there are episodes of sinus tachycardia. I select sinus tachycardia, and this tool shows me that I'm now viewing 0 from 181 such events. So I can start pressing this button, and the software will show me the all episodes of sinus tachycardia detected in this particular patient. Like with the QRS complex, this base rhythm parameter has a bar marker that depicts the full length of the event and the some parameters of this event, like this is sinus tachycardia, duration about 3 seconds, average heart rate 103 beats per minute. What I can do with this event? I can change the length of this event. For example, if I think that this part also sinus tachycardia, I can extend my event here and it will be longer. Or I can make it shorter. Yeah, that's some. In some cases, for example, if the software was not able to detect properly the duration of the event, you can correct it quite in a simple mode. Also, useful thing that I can delete this event. If I think that this is not sinus tachycardia, I just select this event, press delete button, and now I have no sinus tachycardia here. So then I can go to another event and so on. So why it is important? Because for sure, our software is not 100% perfect, so it can make mistakes. But the thing is that you can correct these mistakes easily using these built-in tools. And that's the same thing with the filter works for curious complexes. Here I have never used another analysis tools that exist in the software, and we'll show a little bit further. But for example, I want to see if there are any ventricular complexes that detected by the software. So I can go to this QRS, I could go to the source and find, please show me ventricular, and the software shows me something that considered by the software as a ventricular complex. But actually I see that this is just some noise. Yes, so I can extend a little bit here. You see that was maybe moving artifact. That's actually not some arrhythmia. So what can I do in this case? Okay, I can correct this mistake. I just, for example, press right mouse, edit, and select that this is normal curious complex. So and it's now corrected to normal. Also, you need to understand that sometimes there are false detections. So here the software shows me that this is ventricular complex, but I understand that it's just artifact that does not exist. In this case, I can just delete this complex, and now it is not in there. And here again, I have false detection as ventricular, but I see that this is normal. And one important thing when you perform such editing of the record, yes, sometimes you need such editing manually. Sometimes you do not need. It depends on the record, of your purpose, or the quality of many factors. But anyway, you need to understand one thing, that you should not delete curious complex completely if it's just noisy. Some people do this mistake. That's why I'm focusing on this point. If I delete this curious complex completely, in this case, I will have a pause here. So because I have here, the software shows me, okay, that's instantaneous heart rate is only 53, because the software thinks that there is no curious complex here. So the software calculates the rhythm according to the surrounding. And in this case, the complex is existing, but it's noisy. So if I don't want it to influence some calculations, I can use not normal notation, but U notation. That means this complex is undefined, unspecified. So I can do this. I'm using Shift left mouse gesture to select part of the recording. I think a bit more here, like this, to include Curious T complex here. Then I press right mouse, insert Curious, and select uncertain or undefined. It depends how you, because the U is the same. It means that something. So I know that here curious complex exists, but this curious complex is not very clear. So I'm not sure, is it sinus, is it supraventricular or even ventricular? So, but I want the heart rate to be calculated correctly here. So I use this U notation. So it's just for you to understand that our software has different tools for editing, for navigating, but it doesn't mean that you always need these tools. Depends on your habit using the software. Actually, what I usually do when the record is analyzed automatically, I can review some interesting things according to the this heart rate trend. So usually by naked eye, you can see how heart rate changes. You can see some spikes, and you can just click mouse on this trend to see what's happening in this particular part of the recording, how the ECG change, or if there are some events. So that's very simple thing. And even with simple thing, you can see something interesting. For example, like here, you can see ST depression, classical ischemic type, the horizontal. And if I just without any additional instrument see something interesting that actually makes sometimes the diagnosis for this patient, I can include this part into the report, in the final report, without any other instrument. So I just select, again, I need here my selection tool. I select part of ECG, press right mouse, and here I want add selection to the report. I can have some comments here, for example, ST depression. I can measure using just this millimeter scale, or okay, and now this part will be included in the report and printed out as confirmation of my diagnosis. And just again, remark how you can work with the software. So if you see something interesting, you do not wait for another step of the analysis, just put this part in the report and use it for diagnosis. What else? Here we have mark for this night sleep. It's the black one. Because the software keeps statistics for some events, heart rate, for arrhythmia events during nighttime and during daytime. So for these statistics to be correct, you need to correctly mark sleep hours and wake hours. Here you can clearly see, according to the heart rate, that actually the patient fall asleep here and woke up here. But this black marking a little bit not at the same time. So what I can do here, again, using this shift select gesture, and you actually see that I can use it on this heart rate trend too. I'm select and I can select this fragment and wakeful, and here again this. In real life, patient may be sleeping an hour or about an hour during daytime. So that's normal practice for Vietnam. And you can actually do the stuff if, for example, our patient was sleeping here from 2 p.m. to 3 p.m. I can also select this part and say the software, okay, set selected fragment as asleep. So we can have different, I will not do here because our patient was not sleeping, but if you need, you can put different sleep periods, just not one sleeping period for the day, for 24 hours. Okay, so next I'm going to the, just this, sorry. The very important tool, it calls groups. When I speak about maybe some editing, and you can say, okay, Dr. Fomin, that's crazy thing to perform some editing because we have 100,000 curious complexes and no one want to spend hours for going one by one and check what's happening, if something wrong. So for this purpose, we have a tool that works with groups of similar complexes. First of all, I want to arrange groups by volume. For example, the software found that there are about 70,000 complexes that are quite similar, and I can see these complexes here like an overlay of all these complexes in this group. Using this setting, I can maybe change the brightness. So to see the structure of the group more clearly. This is called map. This map actually created like, like you have a pen and you drawing each curious complex, but with a very thin line. And if you draw one line, another line, in a place where you draw different complexes at the same point, the line will be brighter. And if there is some difference, for example, like here in T-wave difference. So you can maybe see split lines or blurry lines, and it helps you to understand the morphological structure. For example, I hear, okay, this group is very similar in QRS, but this group have different QT, yeah, and a little bit different T morphology, but that's normal because this group contains complexes that with different heart rate, and actually QT must change with the heart rate change. Again, I see that P wave also a little bit blurred, quite bright, and also a little bit blurry here. So I can understand that there are some PQ change, but again, that's physiological phenomenon that PQ may change during day, nighttime. So, and then I see groups that consist of less and less complexes. And till I have some maybe one complex group, yeah, like here. The number of complexes is depicted in the right upper corner. And all these groups are normal. And I see that, yes, okay, it looks like really normal complexes. If I press here on the group panel, the software will show me here on the bottom part of the screen on the ribbon tool one of the complexes from the group, and it creates like a filter that shows only complexes from this group. So if I use this tool for scrolling through, I can go one by one through the complexes in this group. What else? I have another tool. If I double click on this group, I can see the special window that shows curious complexes of this group depicted in a separate window. So I can go back. Another important thing that I can do, I can rename all the group altogether. So previously we renamed one complex from ventricular to normal, for example. But if I see that a complete group has wrong designation, so for example, not normal, but supraventricular, I can rename all the group. I just show you, but it's okay, it's not real. But for example, if I think that this group is not normal, but say ventricular extrasystoles, so I can press this, and this group disappears from the list, and I see that complexes change their marks here. One trick that you need to remember that our software has like a board text editor, have this undo redo function. If I do something wrong and I say, oh, I did something wrong, that this complex is not ventricular extrasystole, that's just joke. So I can easily press this undo button and come back to my original result. What another thing I can do with this group? For example, I see that this group is not similar in the T wave morphology. And in some patient, I may be interested in these different T wave patterns. Just it actually may happen. Or in some curious morphology, it doesn't matter. Here we have difference in T, and I want to see different complexes in different groups. So I can use right button click and split to subgroups tool. I take this marker, I move it to the point of interest. Here I want, again, different presentation. So I want these longer QT complexes and shorter QT complexes to be different. And I just don't want many groups. I want just two groups to be formed. So I delete additional splitting markers. I have now only one splitting marker, and it shows me that actually there are like statistical distribution that these two groups are quite different. It's this graph called histogram, and if you're familiar with statistics, you should understand what does it mean, that we have some complexes in this part, some complexes in this part, and now we can split this group into two groups. Press and split. So now I have about 2/3 with the shorter QT and 1/3 with the longer QT. I can save this and now have just another group. This is how it works. I can do, sorry, somebody very, I can do something in reverse. For example, I can, if I have two groups, but I see that the complexes are similar, I can press Control, left mouse, and then merge two groups into one. But that's not very often used tool, but splitting group tool is quite, sometimes it is quite useful. Another tool that you also need to think useful in these groups, we already faced the thing that we can, here on this ribbon tool, we can change, for example, the end of the T wave marker, the J point marker, but it's difficult to change for all the complexes. It can take a long time. And sometimes here I see the error. Yeah, this complex is marked wrong, so I could like, no, but it's difficult. It can take a long time. So I have a tool to perform this automatically, some correction automatically. I have this group, for example. I have my right mouse click to see drop-down menu and edit reference points. So now the software shows me the current situation. It shows me that, okay, again, we have this histogram presentation that shows how many complexes have, for example, the end of T wave pointed here. So most have here, some earlier, some later, but some complexes have mark very early, some very late. So it may be errors in QT measurement, and these will affect QT measurement result and maybe disturb my clinical conclusion, because I see here the statistics, and for example, for the longest QT, that's 600 milliseconds, that's quite long. And should I expect long QT syndrome here or just error? So what I can do, I can edit reference points. The software provides me with the average curious complex of the group. Then I can use this average complex as a template. I check that, okay, this is the beginning, Q wave, this J point, this is clearly end over T, and I press perform marking. So now using this template corrected by a human, the software repeats the analysis, and now you see that this histogram is much narrower, and the longest QT is now 400, not 600, so more realistic data. And the software selected some complexes like not very similar to the template. It's threw it out into distinct group. And then I apply correction. I have this, just some noisy complexes that now in the distinct group. So, for example, this tool is very valuable if you really want to measure QT correctly, because after automatic analysis, we have some artifacts usually, but if you correct using this semi-automatic tool, you will see better results on QT measurement. Okay, you should understand that all these steps with groups editing is actually preparation. So to have the further statistics and analysis results correct. I have these normal complexes. Then I scroll down to see if the software found some supraventricular. So it's usually supraventricular extrasystoles, but I need to check. So I have these 15 complexes. I press this group and I just look through. Yes, looks like it's looks like supraventricular extrasystole. And in this case, definitely no, that's some error here. So I can have this, control this, edit, and tell this normal. So if I have some errors made by software, okay, but again here, here you see that the problem because the software detected this false detection. So if I delete this, you see that this complex automatically becomes normal. That's a very important feature of our software that I haven't mentioned yet, that it doesn't just perform analysis and then wait for something. It actually recalculates results on the fly when you change something. So I deleted this QRS complex, that's false detection. And now this complex becomes normal because no events, for example, heart rate minimum, heart rate maximum, yeah, during all the recording, or heart rate maximum for this hour. Flexible tool. Okay, you cannot see mean heart rate event because mean heart rate is calculated and there is no actually such an event here. Minimum RR and maximum RR interval. They may be not at the same time as maximum and minimum heart rate actually, because heart rate is calculated as an average and these are instantaneous data. So I can check, for example, what is the minimum RR interval. Usually this minimum RR interval is some arrhythmia, extrasystole, but here it's just high heart rate, actually the maximum heart rate and the sinus rhythm, and I can maximum RR. Is it some pause or it's some artifact? Oh no, here I see that actually this sinus pause, 1,070, almost 1,080, 100. You see that I have a threshold for the pause 1,800. So due to this reason, this event is not depicted. You have no pause marking here. But I can check it with this maximum heart rate tool. And if it is interesting for me, then I need to decide what to do with this patient. Here, yes, that's some sort of sinus dysfunction, but it's not so long lasting. I see normal sinus complex here. So I see that it's 4:57 a.m. So it's some deep night sleep. It's maybe due to some autonomic response during sleep. And I don't think that this is very interesting. In case it's interesting, I can mark it and also send to the report. And another thing that, for example, I can see here that PQ is a little bit longer. And I may want to measure how to do this. I'm using Alt button on the keyboard and left mouse, and I drag with left mouse and say, okay, I have 260 milliseconds. That's longer than 200 milliseconds. It means that I have atrioventricular block first degree. And here He's to 15, just borderline, and here longer. So this may be additional thing about that. It's some vagus reaction that increased PQ, so and RR intervals at the same time. So some vagus activity increased, but it's short. It's not a long pause, so I can just. But for sure, I should mention it in the report, but not a big deal. Then I go here and check what else. I have extrasystoles here, and I again now not in a group, but all the extrasystoles that I can look through. Again, include something in the report. Then what is the basic rhythm? I have sinus tachycardia events, sinus bradycardia events, and you see that using this filtering, I can, for example, press sinus bradycardia, yeah, and again look through what happens during bradycardia. And here in the table, I can see clearly that bradycardia appears only during nighttime, while sinus tachycardia during daytime. So it's physiological response. It's not a problem. I might be interested in this irregular rhythm. What does it mean? That's something that the software cannot recognize as an arrhythmia, but shows me that some irregularity exists, and I maybe need to check. Sorry. But here, nothing interesting. I can just select it and delete. And another, and just some artifacts, again, select and delete. So now I see that nothing interesting left here. So in this particular patient, I don't have any arrhythmia. And I go further to the next analysis window. And this is ST analysis window. And in contrast to the previous, we have some interesting results here. The appearance on this window is very similar to the overall idea. I have a table view with these active links, but instead of some heart arrhythmia events, I have these ST trend and ST events. And what I see here in this patient, actually, I see very characteristic dynamic of ST segment. I have different channels, but the first channel is more representative here. So you see, when heart rate goes up, ST goes down. And when ST reaches the threshold of 0.1 millivolts or 1 millimeter in standard scale, the software marks this as ST depression event. And I see that we have 10 ST depression events that in total lasting more than an hour. Actually, this patient was complaining some pain, chest pain during exercise, while he's quite young, 33 years old. But after this Holter monitoring, he was sent to local cardiology clinic with a coronarography, and critical stenosis of 99% of coronary artery was found, and he was implanted with the stent to treat this condition. So it's not false positive, it's really positive result in diagnosing ischemia. And this pattern is very characteristic for ischemia because we have such a funnel shape. So when ST goes down, with heart rate goes up, and when heart rate goes down back, this ST goes to the baseline. We actually can check, so if we press here, we can check how ST looks. Really, it's maybe not clearly seen, but not the best event. We need to, oh, quite nice event. So here, this PQ and ST is below. And here also on the channel 3. Here's more clear, more classical view. You see ST depression horizontally during exercise that lasts for some time, but this is basic ST position, and you see that in a normal situation we have some ST elevation that's like early repolarization here, but during exercise ST goes below zero line, or so when we check from the zero line, or we check from this initial value, we can find these events. And actually, you see here that this isoelectric level is set to 1.7 millimeters or 0.17 millivolts. So because if I set the zero level to actual zero using this arrow, yeah, the software will not show me the depression events, but instead will show some only one depression event, but will show some elevation event. But I should understand that I can measure ST from not only absolute zero line, but from the level of just resting, yeah, of some patient's personal basic line. And here is 1.7. I can visually see this line, 1.7. Yeah, it's the position of ST segment during just quiet rest. Yes, here. And from here, I can change the ST level. So this is ST level measurement. Then we can go to the next step. For now, I can skip HRV analysis because it's interesting, but not used by everybody. Just sorry, some people want me. But what I want to see, that's QT analysis. Sorry, just respond quickly. So clinically important, usually arrhythmias, ST analysis, QT analysis. So QT analysis, I can see again heart rate trend, and I see this QT duration. There are some artifacts, but if I have a lot of such artifacts, I need to go back to the groups and perform this marking of QT and point. So that's why I showed you before. But here I see quite big chunks of clear data, especially during nighttime, during daytime. And I can check the duration, QT corrected by Bazet formula. And I see that that's 300 with something, so below 400. That means that I should not be worried about QT duration in this particular patient. So I can just say that, okay, QT dynamics is normal. And after this, I can go actually to the report creation and providing the patient with the final result. I do, and maybe you need a couple of minutes to think about information that I provided you. So I just ask you for 5-minute pause, and I will show you quickly another example of the recording. And this is another recording, and even from this preview, record preview, you can see that heart rate is quite different. You see a lot of heart rate spikes here. And in this preview window, I have these complexes marked as red. And this is the representation in our software that shows these ventricular extrasystoles. So I have a patient with a lot of ventricular extrasystoles throughout the recording. So I can just, again, click somewhere on the record to see. Also, for example, I see the problem. Yeah, here this complex is marked as uncertain, but actually it's another sort of extrasystole. So I want to edit this event and mark it as ventricular. And I say ventricular extrasystole. Come on. Yeah, like this. But here the question arises, okay, doctor, you found one extrasystole that was erroneously classified here as uncertain, but if there are different such extrasystoles exist in the recording. So what I can do, I have a couple of interesting tools, and one of these tool that is called apport. That's like in Russian, it's a dog command to search for something. So I select this, and I select, for example, I want to see complexes that are similar in channel 2 and channel 1, because channel 3 here for this complex is low amplitude of 1 and 2, and search among available QRS. So search among the QRS that's already recognized by the software. Okay. And this will help me to understand if there are other such complexes somewhere, maybe in different groups, but I can find them and they will be collected in one distinct group. Under the V label. Oh, just 4 such QRS were found. Okay, so this is another tool to perform some editing. So what else? Again, I can check the basic reading. Okay, have here 35 events. But that's, you see that due to some reasons, our software decided that this pattern of extrasystole and subcomplexes is actually like paroxysmal tachycardia. But that's not true. So I say that these events are erroneous, so that's not true. And I have 35 these events. Should I press 35 times delete? No. I'm using this software trick. Right mouse click, event filter, select all the events from the event filter, and then press delete. So if I see that there is some general error during the recording, I can actually deal with all these events in one click. Let's check what we have in the groups. Yeah, this normal group. Okay. This supraventricular group. And here again, you see that that's in this case, that's not actually supraventricular. That's we have a lot of these insertion extrasystals that just because it's bradycardia, and this extrasystal has enough space to be inserted between two normal sinus complexes. So it means that it's normal. But if I see this group, this group, this group, this group, this group, and this group, and this group, I should rename group type to normal. That's not extrasystals. And here also. So I can rename using, oh, it's okay, it's already normal. But again, I have real extrasystals here. So I can check which group is real, which group is just erroneously named as this. No, yeah, it's real, it's real. So you see that I perform such editing, this uncertain group, but I already see that it's actually extrasystals, ventricular, supraventricular. So for this, I can rename this one to S type, and all the rest group to the V type. And now I see this, yeah, V, different variants of V's. That's not V, that's S. You see that, yes, you need to spend some time for editing, for sure. But in this software, this editing process is quite straightforward and easy to follow, that you can do it quite easily. In arrhythmias, you see here extrasystals. You can go through, yes, check, including the report. And as we have a lot of extrasystals, we have some arrhythmias, for example, by Gemini. Yeah, you see, one normal, one ventricular, one normal, one ventricular. And here, trigemini, two normal, one ventricular. And so we have 90 trigemini, 19 quadrigemini. So you see, and we have some paroxysmal tachycardia left. Somehow it was not included in our deletion, but I deleted it. It's okay. So you see, you can process the record quite fast. And as we have here a lot of extrasystals, we can perform another type of analysis, that's turbulence analysis. It shows if how the autonomic nervous system reacts on the ventricular extrasystals. And in case I have the final score 0, it means that turbulence is normal, so the reaction is normal, and this patient is not in a higher risk group. If we have 2 points, that means the patient's in a higher risk group. You can read somewhere in the literature how it looks like. How to know whether complex cures were correct or incorrect? You just need some clinical experience if you see that it's real QRS complex or just artifact, because if the software found something, yeah, the software thinks that this is real, this is correct, and only you as a human can correct the software and tell it, okay, that's not real, that's just artifact.